So Sarah had kind of a three-part question about the assignments, and is it possible without doing the input from parents about knowing what they're going to be signing up for, and around marketing and about protection from MDE. So Sarah, do you just want to go like rephrase each one of those and we'll get into it?
Sure. I mean, I'm assuming that people don't have assignments yet for the fall. Right.
We're in Bloomington, and we're going forward with all our planning and organizing. We haven't heard anything that we're not, or that there's an option that we're not going forward with the fall.
That's awesome.
In the typical sense, Deb,
Yeah, like
okay.
I just met with, we have a new director, and then we have a new community ed director, and met with them yesterday, both of us coordinators, Galen and I, and we're getting some teachers together next week of work groups to work on the fall plan. And the district is having like a big forum for parents to see and give questions. And so we are just part of the plans for going forward for the fall. Whew. Yeah.
That's awesome. I'm so happy for you.
What district are you in, Sarah?
273 Edina.
Really? Okay.
I can kind of speak to what we're doing in 196, which is Rosemount, Apple Valley, Egan. So yesterday, there's a group of there's several different planning committees. And like I say, that's not the answer to what we're doing for sure. It's just, we're planning for the 3 different scenarios. And so hopefully once we get the news, and we're being told that, when the statement comes out July 27th that week, we'll kind of know where to go from there. And hopefully we'll have these 3 plans in place that we can make good and go in the fall. Yesterday, our ECFE planning committee, 4 of us went out to our building, and then there was 4 or 5 people on Zoom. So we just kind of spaced everything out and put 6 feet apart around the children's room and the parent educator room. We put the Zoom meeting on the smart board just to see what it would look like. We talked a little bit about doing like rotations of families. Like, let's say we had 4 families every week come to the actual classroom and kind of cordon off the children's classroom, and do the same in the parent ed room. So we just kind of measured everything, and the people on Zoom were able to see what it looked like, and then having the rest of the class on Zoom those rotated weeks, if that makes any sense. And, it seemed like if we had smaller numbers, it would be something we could feasibly do. We did a spring survey after our spring classes of distance learning, and that question was asked, would you do it again? Did you like it? And we got really positive feedback that parents would do it again. And, so we haven't sent out a survey since then about what do you want in the fall, which we've talked about. But we did get positive feedback from people saying that they would still participate. And, obviously our numbers were way lower, but we did get that feedback a little bit as well. So those are kind of just some of the things that we're doing.
We did a survey that ended last Friday with parents. It was about a week or week and a half long that it was sent out, and parents had about a week and have to fill it out. So we got, between preschool and ECFE, probably just over 100 responses. And I was so surprised. Like 40% of families said, yes, I would send my child with some concern.
Yep.
Another 20% said that they would send with no concern. That, they would want to know that everything is followed, the CDC is followed, of course, but I was really kind of shocked. And then I talked to somebody in Anoka. She said 65% of their families, when they did a survey, said, yep, we'll come back in the fall.
Wow.
And so this is sort of maintaining the idea of ECFE as a traditional format, so that the children would be in a kids' room and then you'd have parent ed discussion time?
Well, they talked about, like, they would prefer a smaller class, which that's what we would be doing.
Mhm.
And we're looking at, all the options, of course, like everybody else.
Yeah.
And actually, I've just gotten such great support from other districts that I've talked to, really, really good ideas on, how to support all families.
Mhm.
So families who want to come, families who don't feel comfortable, families, that want to do, we can't do Zoom, but, want to do some parent ed. That's the one thing that we didn't do. We did not do any online classes for families and for the parents, and they really missed that. Everything was on Seesaw.
Yeah.
So we are looking at using the Google Meet because we're allowed to do that and figuring something out.
So parents' responses to the survey about, yes, I'd be happy to send my child, was more of that idea around sending children to school
Both preschool and ECFE.
and ECFE. Okay.
Yep.
Yeah. Yeah. Because that seems to be where different school districts are, is sort of that, what are they doing with children? What are they doing for parents? What are they doing for parents and children? How are they? Yeah. So
Yeah.
variety of things.
I'm from a smaller district up north up here, to Sago Lakes, and we sent out a survey. We don't have the results back, or I don't know if the results are being back. So we don't know. I just know that we have 3 full days at the end of August for screening, 9 to 6 for 3 full days, for those kids that need to enter kindergarten in the fall. Otherwise, we don't have anything in place yet until, like you said, Shelley, till July 27th. So that's the only thing that we have figured out. So
Does anybody know if, I'm sure he is, I don't mean to say it this way, but like where Mike Brown is, what he's doing, thoughts that he has about ECFE in preschool? Has anybody talked to him recently? Okay.
And I don't know if Mike's own time allocation changes at all, because his time dedicated to ECFE is very limited relative to his time for pre-K and school readiness and, all of the other things.
Yeah.
So, yeah, it's interesting to hear if any of you would be willing to share the results of your surveys with parents, even the summary of your results. It'd be interesting to, without like pulling the data together, but pull the results together to see how the responses are. And my guess is they're going to be relatively similar, and they're going to reflect the spring. And what's going to vary is what happened in the spring. Like, as you were saying, Deborah, like that if you couldn't do video conferencing, then, or if you couldn't do much parent ed, and your focus was on early childhood, whereas in other places they tried Zoom and doing that, or they tried asynchronous discussions with parents. Or I know, Sarah, in your district, you were using Schoology, things like that. So, but I know from the survey that we had done with parents in different school districts that were using Parentopia, less about Parentopia, but more about early childhood, was that was the main thing that they sort of responded to that didn't work relative, like to do just video connections with children and call that, traditional ECFE early childhood just was not the same. That, kids weren't having the same kind of connections with their teachers, but parents did overwhelmingly respond how much they understood the teachers were trying, that they were, that this came out suddenly and that they were trying. And it was just that as parents, they seemed that, it seemed to work okay for me. It was great for communication. It was great for getting information about my program. Like, we could still do that online, but in terms of my children, in terms of their own sort of socializing with other kids and connecting with their teachers, of course, that's really hard through a virtual experience. Sarah, what other questions did you have about marketing or?
Oh, it's super helpful, you guys. Thank you so much for that perspective. It actually is hopeful to me that, so many parents in other districts, and I'm sure that this is true of Edina too, we just haven't gotten that information, or maybe I just don't know about it, are really committed and are going to want to see this programming. And maybe after we get the guidance from the governor on the 27th, we can go full bore and, figure out based on what we've all been talking about this summer and what we can do, how to make it happen. I was curious if Naomi or Angela wanted to add anything to, this just sort of general conversation about what plans are shaping up to be.
Last I heard from our coordinator was July 15th was the date that we'd get our letters of agreement. But that was back when we were still in session for the spring. I haven't heard anything to contradict that at this point. Her and I have had just very few brief conversations, and she seems really hopeful. I will say though that our district, especially our superintendent and a lot of the school board have our back. And so I'm hopeful that that's going to be to our benefit. We have a lot of great support from higher up in the district. And so I think as long as the funding is there, I'm hopeful they're going to try and make it happen. But I don't know what that's going to look like.
You got your Wayzata, Naomi, is that right? That's great.
Yeah, so I mean, we'll see what happens. I was given some guidance to start kind of looking into Canvas a little bit. That is our district's platform. And so just trying to become familiar with that. We did not do any of the asynchronous discussion stuff. And that's something that I'm kind of looking into possibly doing more of. Should we be fully online in the fall, or if for those families that aren't comfortable coming back. That's as far as I know with us. But
do you have, Naomi, do you know, are you getting good support from the school district on using Canvas?
My coordinator just talked with me late last week and just said, hey, start kind of looking into it a little bit. Canvas is already being used by our middle school through high school, I believe. I think Seesaw is our elementary kids, as well as the early childhood special education. But our preschool program does not use Seesaw. They were using other ways of communication during distance learning. So I'm just basic learning what Canvas has to offer. So
first of all, I'm happy to help you and answer any questions that I can help as the university, when the university released Canvas for us to use, they kept adding things to it, right? So, it has some advantages. However, I'll be very interested to hear your experiences with parents. Unfortunately, I think, not to be a Debbie Downer about it, but relative to some other learning management systems, the discussion boards are not as flexible as some others are. So, but anyway, you can.
What do you mean by flexible?
Laura, let me know if you have any questions that I can help answer for you. Cinnamon, how about you?
So, like I said, we don't know anything really. A survey went out a couple weeks ago. We know that we have 3 dates in August coming up for screening. But for contracts and stuff, I guess it just depends on when that happens. But I have a note to talk to my supervisor about our survey results and then letters of agreement, just so that I can bring it back next week to this group. So, yeah.
Great. I was just looking back through chat too. Angela, I think you're probably muted, but you had mentioned that Hopkins is currently broken out in task forces, and they're making plans for all 3 scenarios as well. Is there anything you want to add to that? Oh, and you have a survey that's going out in July.
Yeah, so the district has multiple task forces, and we've been broken out into early childhood and kindergarten to include all ECSE, ECFE, preschool, and then kindergarten. So we get together twice a week, and we are just looking at how to plan. So our focus is not on the organizational components like busing and safety or whatever. It's just strictly on planning for those 3 scenarios. So what does it look like if we just come back with CDC guidelines? What are those classes going to look like? Are we really going to be able to still accommodate for the same number of people that we have had in the past? Because CDC might require us only to have X number of people in the classrooms. So then what do our classrooms look like? And does this restructure of ECFE look different? Whereas we used to have a very large variety of classes, of infant classes, of 1 to 2s, 2s to 3s, multiple classes, Spanish classes, Somali classes, and all this. And now we are having to kind of silo them, for lack of a better word, into, we have our infant teachers and children's teachers, and how do we structure an infant classroom? And do we offer it 1 or 2 times a week? And then we also have to accommodate too, we have to plan for if our buildings are being used, for K through 12. We have 6 buildings, but they may have to come into our ECFE building or our early childhood building. Where do we fit in the puzzle? So just looking at the bigger picture of programmatically, how will those run?
Mhm.
And so we do have the survey that we're putting together. We have to we're having everything translated, and then also developing a plan. That's why we're not putting it out until July 10th. But how do we reach those families that can't access the survey or can't take the survey or just don't want to take the survey because they don't feel comfortable doing so?
Mhm.
So that all families are heard, to have that equitable level of connection with families. So we're doing a lot of different things. There's a lot of moving parts, and as far as schedules, our direction was July 15th that we would like to have something out, but that I don't see is happening. I think it really depends on our registration. So, because we're not contracted like Edina is. We just go based off of classes and registration, and we try and formulate a schedule based on those registrations at that time. And then we can always add to teachers' schedules if a new class is developed or added. So I hope that answers some of your questions, but that's kind of what we're doing.
So Angela, who's sending out your survey? Is that from your school district or is that specific to ECFE?
So we've all developed our own surveys, but they're all branded with the Hopkins branding. So we have, 1 through 12, and we have early childhood, and we have a separate kindergarten one because kindergarten seems to be slightly different, right, outside of 1 through 12. And it's different than early childhood. So we have 3 surveys that we're working on getting translated and whatnot.
And then, sorry, I do this stuff. So and then the big deal is this idea of accessing families,
Yep.
Which in my mind means resources.
Yep.
So, and I guess that's why I was asking if this was the school district or this was ECFE. Who's putting the resources into ensuring that survey gets into the folks that either don't have internet access, don't want to do it online because they're just fed up of screens, or are, they're just not responding and you need to come back to them 2 or 3 times.
Yeah, it's definitely district perspective of making sure that we are listening to all of our families E through 12.
Yeah.
So we've talked about, is there a call center type of task force that we put together that are reaching out families that teachers know of that really don't have that technology savvy or desire to communicate, but still want their voices heard.
Right.
So what does that look like? And so we have very limited number of days left to try and get this figured out, but that's what we're hoping to try and capture along with the normal surveys, because we already know we've done surveys in the past already in the spring. So we have an idea of the families that are already going to answer those surveys.
Right. Right. So it's okay. So that's heartening though, because that sounds like there's some central administration support to getting this out more widely.
Oh, very much so. Yeah. I mean, we have our tasks. So our task forces, while they're separated, traditional one through K, we have our task force. We have, I can't remember all the other names. There's like 3 or 4 other task forces. And then each task force has a lead. I'm the lead for ours. And then we meet on Thursdays and we collaborate on what we've done or what we've done in our groups, so that we kind of everybody has a picture of.
And Angela, that's a colossal task. It sounds amazing. Do you have teachers or other stakeholders in your task forces too?
Oh yeah, we have ECSE represented. We have community ed represented, because community ed also provides our child care. So they have to be involved with, are we looking at maybe half-day kindergarten, or like an AM or a PM, and how does that intertwine? We're looking at preschool and ECFE. And so, yeah, I think I have 14 on my team, but some of the other task forces have well over 30. And a lot of these are, well, everyone is doing this voluntarily.
Wow. That is big. So, Deborah, I've got 2 questions for you. One is, I'd like to get to your immunization question that you posed earlier in the thing. Before that, though, and this is to everybody, but it's stimulated by something Deborah had said, and that's about resources. It sounds like, you're in a situation where in part you're waiting to hear sort of from the top down of other people have made some decisions that will affect you, and then you can start planning. And then in other cases, you're like Angela, you're part of a big group of people who are on this and helping towards making decisions. Your infrastructures are different. Again, contract model versus sort of see who signs up kind of thing. But Deborah, I was struck by you were saying that you've been very much helped by other school districts, people from other school districts who sort of weighed in on and gave you some information about parent ed or using Google Meet, or sort of broadening your early childhood outreach and that sort of thing. My general question was, as you sit here now, what do you need? I mean, what resources are most helpful to you to help you move ahead? Is it information? Is it waiting for survey results? Is it waiting for sort of top down? Is it a matter of time? I'm just like, what would you say you need the most to move ahead at this point?
No, I feel like I've talked to enough people. I've tried to, read enough and try to, as much as I can, stay connected with this group. And so we have, I met yesterday with, both of our bosses, And so we're going forward. I've got a work group of ECFE staff scheduled for next week. And what I'm going to do is just lay out, they've already, in the spring before they left, we did some brainstorming on, potential ideas, and especially in the hybrid, so I have that information. I have everything that I've heard. I've talked to other districts. And so we just really need to hone in on what we believe is going to be the best options for Bloomington. So that's what we have scheduled for next week.
Okay.
Yeah. So I mean, I feel good. I kind of want it done, but I'm, that teacher part of you that just wants it all complete and ready to go. But I feel like we're gonna probably have to work really hard, after the 4th and get this organized and ready to go, because just because our program, we have, our director was moving out, new director coming in, like we have a lot of transitions going on. And so we probably would have had this all planned and ready to go. And so I'm a little nervous about our timing, but because I'm hearing from other districts that, they're not including ECFE, we just really believe we need to be ahead of the game and organized and ready to go at the drop of a hat. And so that's why I'm glad that we at least have a meeting to get going for our district next week.
So can I just ask a quick question of you? And I maybe missed this. Are you guys planning for different models, or are you just going forward with school as normal? And is anybody in are they talking about waiting till the end of July, or are you guys just moving forward with the in-person school?
We are planning, we have to have our 3 models, the traditional, the hybrid, and the distance. Okay. We're calling it distance learning 2.0.
That's what we were trying to rename ours too.
Yeah. And so the district, they've already been in their work groups. They have a lot of it planned. And that's why they're doing this forum for families on July 14th. And so that's what we are, we have to have it completely organized. And so I just want to give as many options as I can to the ECFE teachers next week, so that we can, hone in and say, no, this is really the best thing for our families. And of course, our ECFE teachers, they know the families the best. So I feel like there's enough information, and I've got some really good ideas from other districts that we'll meet and go ahead and decide, and then just get it organized and ready to go for the 14th for us. Does that answer what you were asking, Shelley?
Yeah. And so you guys don't have your contracts yet either, or do you?
We haven't heard anything, so we're just assuming everything's normal. Okay. And we're part of the teacher's full contract. Yeah. So, I know. So our community ed director he's just talking like we're planning, we're doing it, but there isn't a hesitation on our part that we've noticed from him. So I feel very grateful. I'm a little concerned about paras, and what they'll be doing. And he did ask some questions when we met yesterday about that. And, I think that there's going to be enough for them to do, both in preschool and ECFE. ECFE a little bit less, but, for sure, if we go having classes, like, smaller classes, we're thinking about, paras will go out, they'll get children either from parents and or the bus and bring them in. So as few adults are in our building as possible. And then our ECFE classes, I think many people have said this, looking at 4 people to a class. So one idea, you guys, I've missed a couple of these meetings, so I apologize if I'm repeating, but I had talked to Carol Benjamin in Anoka. I think that's her name. and just asked her about what they're doing and ideas. And so they are looking at one of their options. They have like 3 hybrid options. So option B of those 3 options is to do in the morning, they'll have 3 one-hour classes. Parents and kids come in small classes, I think 4. So they come into the classroom. It's kind of like a parent-child interaction time for an hour. And then, so 3 of those happen in the morning. And then in the afternoon, like at 1 or 1:30, they do a 1 hour, 1 hour and a half, like Zoom parent ed meeting. And so all 12 parents from those 3 classes in the morning will be in parent ed in the afternoon on a Zoom meeting.
Great
I was
idea.
like, I love that idea. You guys probably already heard that, but I hadn't heard that one. So I was like, oh, interesting. Yeah. So I mean, I just think, everybody's really thinking this through and has some really good ideas.
Welcome, Ellen. Before we, Carol, Deborah, do you want to ask your immunization question?
And so we were talking yesterday, and the director is just wondering, like we've gotten pretty strict about, everybody has to have all their immunizations. They have to be up to date before they can come to class. And, our ECFE secretary is like, she's just amazing. And like, she's calling everybody 4 or 5 times and really making sure everything is taken care of. But as we look to the fall, our question when we were all meeting was, do we need to be even more strict, or like, people haven't been able to get into their doctor. And so do we need to loosen the reins for at least 1 semester, like where? And so I told them I was meeting with you guys today and I would just get your feedback. Do you know where your district's at with that and what you're doing?
I haven't heard that from anybody. That hasn't been a conversation we've had at all, but it's a great question.
I could certainly ask. Deborah, I have no idea. I'm sorry, Deborah, could you say that again? I think you were muted that last sentence.
I tried to mute so I could listen. I would love to get feedback from people. Are we meeting next Tuesday again?
If you want to.
I could do that, or I could give you my email address. It's fine with me.
Deborah, if you'd like, I can send out, I have this running email list of people who have been joining our calls, and I can send out a message and maybe even, and just ask them and CC you. I mean, you'd get it anyway, and just ask for people to share their responses on what they've heard about immunizations. If you could maybe phrase the question for me the way that you would like it asked.
I would like to know how strict people are being with making sure that families have all their immunizations up to date for their children.
Okay.
For the fall.
Deborah, so I don't know anything about the immunizations. I just know that for myself, I don't need shots, so I can't get into my doctor, right? But my child, who is 12, can get into the doctor and can get her shots. So I wonder if that will play a factor in on it, saying, okay, if you can get into your doctor and your child needs shots at this time, they're just going to have to allow you to come in and get those shots. Now, I don't know how strict your district will be in saying that they have to do it. Like I know this last year, our nurse was really strict about our kindergartners coming in, making sure they had all their immunizations caught up to date. Yeah. But that's what I know right now, but I don't know where our district is going with it. So That's just a personal, from me, so.
Yeah, typically we're pretty strict. But the question that our director had was, do we need to, for once, and I'm assuming for one semester, just be a little bit lighter on that? I don't know.
Would lighter be like the buzzword at the university is flexible? So I didn't come up with it. I hear it all the time. So would that mean, so rather than a date like September 5th, immunizations must be in or something, that there's a little more flexibility in getting records in? Would it be something like that?
Yes,
Okay.
that's my question.
Okay. Okay. Good. Thanks. So others of you, how about what resources are you feeling like you need to move ahead with? Or maybe let me ask it more directly. The word hybrid is a pretty vague term. Yeah. So if you were told you had to do a hybrid model, what would that mean to you?
We've already talked about that a little bit, and we've decided that our hybrid model is going to be, we're going forward with classes in the fall, in person, smaller. I'm really disappointed that I lost track of time. I'll have to go back and watch and see what you guys said, but we're going to offer a virtual option for any family who wants to participate. It makes a lot more work for us, obviously, because we have to have a camera on and move it around with us and whatnot, but we're just going to offer in-person classes and have a camera around and Zoom available for any family who wishes to participate in that way. It's figuring out, like I ordered yesterday a tripod for my phone so we can move it around the room so we don't have to hold it. I actually already started doing this for our newborn class. We have a newborn class that runs year round. And last week we got together for the first time in 14 weeks, and I had 6 moms come in person. We sat outside, 6 feet apart with their babies. And then I had 2 moms call in on Zoom. So already, I've had 1 week, but that's what we're going to offer. Ideally, we'd like to not have to do that for all of our classes.
Mm-hmm.
Like if we could have like Tuesday toddler, we'll have a virtual option, but Thursday toddlers won't. Just so we're not, messing around with the technology for every single class. But I don't know that we can do that. So, but that's what hybrid to us is going to look like.
Ellen, can you remind me what district you're from?
I'm in Northfield.
Thank you.
Mm-hmm.
Ellen, how many?
I'm sorry.
Ellen, how many families did you have signed up in those classes, or do you plan on having them?
So our multi-age classes are capped at 12, and they were all full this past spring. Obviously, we're not going to do 12. I think we're probably going to cap at 8. Okay. And then our toddler classes were capped at 10, and I think we'll probably cap those at 6. But when I came on, I loved the idea of what you were talking about, having parent-child interaction time and then parent time later. That's a really great idea.
Yeah, really good idea.
Yeah. So we haven't really talked numbers yet, but and then it wouldn't matter, if we have 6 toddler families in person and 2 attending virtually, great. That's fine. We can have 7 families attend virtually if they want, and we'll hook them up. We have Apple TVs in each classroom. Well, we're moving buildings this summer, so we hope that they'll be hooked up. But we have quite a few families with siblings with cancer and spouses with cancer. So this is an option that and pregnant moms, now we know pregnancy is super high risk. So yeah, we'll see.
Ellen, did you guys pay attention to how close people were during that in-person class, or?
So I knew exactly who was coming, because these are moms who have been coming to the class virtually for several weeks. Okay. And so I knew that 6 of them were coming. So I sat out 6 chairs, 6 feet apart, and they had to wear masks as they came in the building. And as soon as they were outside and spaced appropriately apart, public health, because our public health nursing is part of that, and the hospital. And they said, you can, if you wish, remove your mask if you don't want to. And everybody removed their masks. They were all okay with that. And they kept their babies close, and they laid them on the scale if they wanted to weigh them. Some of them did, some of them didn't. But just trying to create some semblance of a class for them in person. I'm really concerned about maternal mental health.
Yeah.
So it sounds as though a commonality across everyone is, and this is following the CDC guidelines, is smaller groups, smaller classes, and when they are together, masks and distance. One of the, and then for early childhood, one of the comments I've heard from some teachers has been, you know, the socio-emotional development of young children, but then the other thing is masking little kids and keeping them apart. And so for those of you that are thinking of like 4 kids at a time or 4 toddlers, you know, what are the mechanics with that? I'm just curious. Are you thinking these children the children are just not masked, that's just silly? They're keeping them apart, it's just silly. So if the parents are fine with bringing the kids in and there's only 4 of them in a classroom with 1 teacher or something, how is that working, do you think?
We talked about like coordinating the room, and like we moved some furniture around yesterday and made like 4 different areas, and talked about having like similar toys in each area and having the parent with the child kind of stick in that area. We talked a little bit about separating and going in the parent room too, if we could keep the kids separated. We haven't talked about masks on children at all.
Yeah.
I don't really think that's something that we're thinking about. I could be wrong, but.
Shelley, do you mind sending photos of your classrooms?
Yeah, but I have a couple.
That would be great.
Yeah, I mean, like I said, this was just like one morning, you know, first try. We looked at, we all have iPods or iPads too, and so we looked at the stands for those. Kind of, Ellen, like you were talking about with your iPhone. We looked at ordering that so that if we had some people in person and some people virtually, we could kind of move that around. And people are going to miss stuff if they're on Zoom, and some people are in the classroom, but we decided that that's just what's going to happen, you know. So, but yeah, I will pull those pictures up and send them.
We also had a concern of, you know, even if you're teaching like 2 classes in a morning and you're going to use two rooms, you know, for each classroom. So only, you know, 1 set of families are in a classroom per day, you know, but, you know, staff are moving between classrooms, and, you know, frankly, little ones, we all know about their snot and their germs are just everywhere, you know, and we love them through that. But
Speak for yourself.
handle snot, but hey, whatever. But I did suggest that, you know, maybe the teachers need to wear like really light kind of a jacket, and that's the jacket that stays in that room, and they put a new jacket on, you know, light covered, you know, almost like what, you know, the nurses and doctors wear, you know, in the hospital, something really, really light, but that just to, you know, stay a little bit cleaner. So I don't know where we're going to go with that, but that was another concern that came up.
Well, and are you guys thinking about not using the same room twice in one day? I mean, like, so we have 2 rooms. We have an infant room and a preschool room. And we did have some programming where we do have, you know, a class from 10 to 12 in a room, and then again at 1:30 the same room. Are you guys thinking about not doing that in the same day?
We're just like between preschool, they will use the same classroom, you know, between morning and afternoon. And so there was a concern about, you know, they're going to have to really heavily clean that in between. And then when I was looking at ECFE, and I'm not saying that it's going to happen, but I was looking at the 2 sites that we use for ECFE. We do have 2 classrooms at each site. So if we did 2 classes per morning, we could potentially just use 1 room per day. You know what I mean? Because you could use both rooms. So, but I don't know, like that idea about doing 3 1-hour classes in the morning and then doing the parent ed in the afternoon. I really like that idea, but we would have to double up somehow. So,
And you
I
were
just
thinking
think,
about doing, the parent ed in person, right? In the afternoon? All
nope,
those,
that would be,
oh,
that would be
that would be
like, well,
virtual.
we have to use Google Meet.
Okay, got it. Okay.
Yep.
Thanks for clarifying.
We'll see. I haven't presented it yet to the teachers, the ECFE teachers, to see what they think about that. That was something that they're going to try in Anoka, Hennepin. And I thought that was a good idea. So we'll see.
I was just looking, there was an article in the New York Times last week, I think. It was something about what can teachers learn from childcare providers, and it was an article about the childcare settings that have been offering childcare throughout COVID for essential workers families. And anyway, there was just some guidelines and how-tos about how the teachers have been staying healthy with the children, how they've been able to continue. Anyway, I was just thinking an article like that might be useful as some guidance for, some of this stuff. And I'm hopeful that whatever you all are getting from the state by the end of this month will also give you some good guidance on that. Because a lot of the strategies that you're suggesting, sound really practical and yet really necessary.
Mm-hmm.
So I'm curious, a lot of you have talked about distance learning 2.0. So what did you learn from 1.0 that you will do differently?
Well, we were only allowed to use, the teachers were only allowed to use Seesaw. And so, we just used our standards and had a lesson for, young children, for the kids, and then another lesson and just ideas and thoughts with for parents only. But we have to add some parenting classes, so we would definitely be adding on, and that might be like groups of people. It might be just one-on-ones with people. Just trying to we need to find better ways to connect with the parents and then getting the parents to connect with each other.
Mm-hmm.
So we were looking at Facebook too. Maybe you guys know, one of our teachers was looking at Facebook to do like having small groups just meet so they can talk throughout the week, but it would be a closed Facebook page also. So a parent educator and early childhood teacher will be responsible for that that page. So we were looking also at that. I don't know if anybody has experience with Facebook.
I did that, Deb. I just set it up right at the beginning of distance learning. I just I set up a group and then I invited families through email. I said, hey, here's a group. Some families used it heavily and other families didn't use it at all. But I had one group, they've been together, their kids are all 3. They all turned 3 this year. They've been together since their babies were newborns. And
Right.
they were posting pictures of things they were making and things they were doing and recipes for super spiked double shot coffee for each other, But it was nice. It was nice. But there are some moms who just don't participate. They're not on Facebook at all. But if everybody in your group is on Facebook, it's perfect.
Yeah.
Right.
Yeah.
That's one thing I think, you're asking what we learned. We did the Zoom meetings for the parent groups, and then we did Seesaw, and it worked well. But there was that piece that was missing that the parents could share with each other more than just on Zoom. So I think that's one piece that if we're in distance learning or a hybrid model that I would like to incorporate. So it's good to hear that Facebook might be a good option for that.
Mm-hmm.
I think I'm going to make families use. Oh, I'm sorry, Susan.
I was
gonna
just going to say,
use Schoology.
Shelley, you're in Rose. 196 is using Parentopia, and that is something that. Oh, and Ellen, I'm just going to.
We can use Parentopia.
Yeah, you can use. Yeah, you can use that. They can share with each other and post.
Yeah, right. Yeah. So we're kind of looking at that because I feel like that is something that we were missing in the spring. So good to hear that feedback.
Yeah. And Ellen, I'm offering it too for free. Honestly, if you want to use it.
Mm.
Seriously.
Oh, I do.
Yeah.
That would be delightful.
Yeah.
Really delightful.
Yeah.
I don't know. I mean, honestly, you guys, I feel like, sorry, my light's really annoying. I kind of feel like after this, I'm never going to want to do a virtual class ever again. You know what I mean? Like, I think we've all talked about, oh, we could offer a virtual class. Wouldn't that be fun for some of our families who can't come? But I feel like I'm going to have PTSD and I'm going to be like, oh, I could. I just don't want to. I don't know if anybody else is feeling that way, but
Yeah.
gosh, I miss seeing those families in person.
Actually, Ellen, I'm curious, besides missing seeing the families in person, what else does not work for you? Like what is causing you that, would cause you that PTSD? Just what else?
Not being able to see the kids either. I mean, the kids are so much joy and they're so fun, and watching the interaction between those families, and then, you know, seeing the typical 4-year-old behavior, you know, and mom is flipping out and I'm like, it's okay, she's 4, you know. I'm just a little worried that some of those typical behaviors that I can't see, I guess I'm worried about kiddo development too.
Yeah.
Sure.
Yep.
Yeah. Thank you.
Yeah, I was thinking the other day that, you know, one of the things is the sort of the random moments, like because I don't really care to go to campus, and I don't really miss going to campus. I realize one of the things that that I get when I have to go to campus is that those random things of like walking by a field and the people from the Raptor Center are out, you know, like training the Falcons, or running into a student from a year ago that I haven't seen, you know. And when our lives are so confined, you know, a lot of that randomness is gone. And I think it's the same thing with like little kids are, if anything, not on a schedule. Like, I mean, we want them to be on a schedule, but their reactions and their behaviors and you know, all of that, their snotty noses and what they say, all of that is not, you know, it's not predictable. And so, and that's lovely. And not being able to see kids, you don't have that either. So, well, here we are. It's a little after 1. Is there anything, I don't want to leave anybody with anything burning or a question. Does anybody else have anything else you'd like to bring to the group? I'll keep, you know, offering these every Tuesday at noon, as long as folks are around. And if for some reason I can't be here, I'll see if somebody will co-host, which simply means just opening up the Zoom window. Anything for the good of the crowd? Questions, thoughts? Hashtag uncertain but hopeful. Well, I do hope whatever progress you can make this week is made through your discussions, through your information, from your interactions, from your inspirations. Yes, thank you, Deborah. Happy 4th to everybody. That's right. It is a holiday weekend. So enjoy the 4th.
Holiday. What is a holiday? What is that? How do you spell that? Give me an example. What do you do on a holiday?
This year it's with a little H.
So we are having firecrackers right outside our, you know, in our cul-de-sac. Like firecrackers are already starting up. So
There you go. Okay, everyone.
Thank you, Susan.
Thank you.
You.
thank you. Take care, everyone.
Take care.